The Doc is In is sponsored by Amada Senior Care.
Welcome back, Fox 56 News. Chief Medical Contributor Dr. Ryan Stanton is back in studio with us.
Today he's here to raise awareness about something obviously very important, ovarian cancer.
Yeah, so just a couple of days ago I was working and a patient came in and said that she watches us here on the news in the morning, and so I said, hey, you get to pick the topic. What do you want me to talk about? So she asked me to talk about ovarian cancer. I asked if I could mention her name. She said absolutely. So Joy suggested this topic, and she said if she can help one person, then she's going to consider this a success. So here we go. So once I talked to Joy and talked about ovarian cancer, it's one of those things that strikes so many people. It would all be worth it if we can get the word out there, so here we go. And hopefully we can help many people. Ovarian cancer is one of the most common cancers and leading causes of cancer within women. About 1 in 87 will experience the diagnosis of ovarian cancer during their lifetime. Unlike many cancers, this is one that impacts older women, with half the cases being diagnosed over age 63. The good news is the rate of ovarian cancer has been dropping over the past 30 years, with about a 1 to 3% decrease per year from 1990 until 2020, felt to be related to the increased use of oral contraceptives and the decreased use of postmenopausal hormone replacement therapy. Now, the key with this diagnosis is early detection, which includes responding to any type of symptoms, having a primary care physician, regular checkups, preventive care, and continuing your gynecologic care and preventive evaluations. So this is one of those that it's very hard to detect, but at the same time, it's one of those that if we can catch early and with modern treatments, we are decreasing the complications, the death rate. We'll talk about that coming up at about 7:50, 7:55. We'll talk about some of the treatments and improvements that have taken place over the last number of years.
Aren't some of the symptoms with ovarian cancer like back pain and just very symptoms that you can experience in every day-to-day life?
Exactly. The symptoms, once they start to present, tend to be very non-specific. They could be anything: upset stomach, lower abdominal pain, all kinds of things, feeling full early. So it's not one that you're going to get the symptoms and say automatically, oh my gosh, it's ovarian cancer. And that's what makes these very difficult to detect, and why it's so important to work closely with your doctor and not wait until you have more advanced symptoms.
Doc, thank you very much for the information, and Joy, thank you as well for suggesting that this morning. We'll have more on that, as he said, coming up toward the end of this hour newscast. But more right after this, right?
Exactly.
You're watching Fox 56 News. Our home, your news.